Sacroiliac joint pain. The sacroiliac joint is located between the iliac bone and the sacrum, connecting the spine to the hip. There are two sacroiliac joints, one on each side. Strong ligaments and muscles support the sacroiliac joints. While technically the sacroiliac joint is a typical synovial joint, unlike other synovial joints in the body, it has very limited motion. Full movement at the joint is only achieved when the hip joint has reached its farthest range, such as rotating the hip outwards to the end of range. The main functions of the sacroiliac joint is to provide strength and balance the forces between the upper and lower body, and also to act as a shock absorber for these forces. Pain arising from the sacroiliac joint is one of the potential causes of axial low back pain. In fact, the sacroiliac joint is the source of pain in 15 to 30% of people with chronic low back pain. Joint pain can be acute or chronic. Acute pain occurs suddenly and usually resolves within a few days or weeks. Chronic pain may come on suddenly or slowly over time and lasts for more than 3 months. It may be a constant pain or only felt with certain activities. The potential causes of sacroiliac joint pain can either traumatic or atraumatic. The traumatic causes of pain are pelvic ring fractures, soft tissue injury from fall onto the buttock, indirect injury from motor vehicle collision, and sudden, repeated heavy lifting, strain or torsion. The atraumatic causes are sacroiliitis. Ankylosing spondylitis or psoriatic arthritis can cause inflammation in the sacroiliac joint, as well as the vertebrae in your spine, which leads to pain and stiffness in your lower back and hips. Osteoarthritis, which occurs when the cartilage that cushions and protects the ends of your bones gradually deteriorates, may affect the sacroiliac joint's cartilage and cause pain. Infection. In rare cases, the sacroiliac joint can become infected and degenerate. Sacroiliac joint dysfunction. Joint pain can occur when movement in the pelvis is not the same on both sides. Uneven movement may occur when one leg is longer or weaker than the other, or with arthritis in the hip or knee problems. Previous lumbar spine surgeries. Fusing vertebrae reduces flexibility in the spine, which can increase stress on the sacroiliac joint. Pregnancy and childbirth. Pregnancy causes sacroiliac joint pain from weight gain, increased lumbar lordosis, hormone-induced laxity in the 3rd trimester, and the trauma associated with delivery. Scoliosis. Obesity. Obesity adds stress and strain on the joint, can increase the likelihood of developing pain. Sometimes there is no clear cause for sacroiliac pain. Symptoms. Patients usually complain of deep-seated pain, which usually start in the lower back and buttocks, and extends down the posterior thigh, knee and even the feet. Pain can frequently mimic and be misdiagnosed as radicular pain. While the pain is usually one-sided, it can occur on both sides. Symptoms may worsen with prolonged sitting, standing, sleeping on the ipsilateral side, walking or climbing stairs, going from sit to stand, or standing on one leg. If the cause of the problem is due to joint pathology and inflammation, then the patient may also experience pain that feels better with movement and worse with rest, and often wakes the patient up in the middle of the night. He may also experience stiffness in the lower back that is often worse first thing in the morning. Diagnosis. A thorough history of clinical symptoms and past medical conditions should be a routine part of the comprehensive evaluation of a patient presenting with sacroiliac joint pain. A physical examination will help determine whether the sacroiliac joint is the source of your pain. The doctor will feel around the pelvis, lower back and sacrum to find exactly where it is most painful. He will feel for tenderness over the joint below the waist where 2 dimples are visible. Legs length should also be measured. After that, the doctor will complete a series of specific clinical tests. Numerous sacroiliac joint provocation stress tests are available. Unfortunately, there is no single test that is both sensitive and specific in identifying sacroiliac joint dysfunction. A few of these maneuvers are Patrick's or Faber's test, flexion, abduction, and external rotation. The patient lies supine on the exam table. Flex and externally rotate the hip and knee of one leg to rest the lateral malleolus just proximal to the contralateral patella. Pain in the sacroiliac joint region is considered positive for sacroiliac joint dysfunction. Pain in the hip or groin suggests hip pathology. Ganslin's test. The patient lies supine on the exam table. Flex the contralateral hip and knee towards the patient's chest while the opposite leg is allowed to drop off the table's side. Pain in the sacroiliac joint region of the lowered leg suggests sacroiliac joint dysfunction. This test may also be performed with the patient lying on the side. Sacroiliac joint distraction test. The patient lies supine on the exam table. The examiner applies an oblique load, downward and laterally on both the anterior superior iliac spines. Pain in the sacroiliac joint region is suggestive of sacroiliac joint dysfunction. Thigh thrust. The patient lies supine on the exam table. The examiner flexes the hip and knee on one side till the thigh is vertical to the exam table. The examiner wraps an arm around the flexed thigh and knee and places one hand under the sacrum, then he applies a downward load through the femur. Pain in the sacroiliac joint region is suggestive of sacroiliac joint dysfunction. Lateral compression test. The patient lies on his side. A downward directed compression force is applied with the heel of the hand to the iliac crest on the top. Pain in the sacroiliac joint region is suggestive of sacroiliac joint dysfunction. Sacral thrust test. The patient lies prone on the exam table. A downward directed force is applied with the heel of the examiner's hand centrally over the sacrum. Pain in the sacroiliac joint region is suggestive of sacroiliac joint dysfunction. The presence of 3 or more of the provocative tests will increase diagnostic accuracy. X-rays can diagnose, exclude some bone pathologies such as fractures and osteoarthritis. MRI may show signs of sacroiliac joint inflammation or other possible sources of pain, especially within the lower back, pelvis and hip complex. Image-guided injections are the gold standard to confirm the diagnosis of sacroiliac joint pain. An injection of steroid and anesthetic into the sacroiliac joint can be used as both a diagnostic test and also treatment. The injection is given using X-ray fluoroscopy to ensure accurate needle placement in the joint. The pain level is evaluated before and 20 to 30 minutes after injection and monitored over the next week. Sacroiliac joint involvement is confirmed if your pain level decreases by more than 75%. If your pain level does not change after the injection, it is unlikely that the sacroiliac joint is the cause of your low back pain. Treatment. The treatment of sacroiliac pain depends on the symptoms and on the underlying cause of the pain. Medications may be recommended for the treatment of sacroiliac joint pain. These typically include over-the-counter pain relievers such as anti-inflammatories drugs, NSAIDs. Topical treatments such as heat or ice may be used. Physical therapy is often recommended as well, including stretching and strengthening exercises. Pelvic stabilization belts can be useful in pregnancy-induced sacroiliac joint dysfunction. The patient should modify or avoid activities that worsen his pain to help reduce inflammation in the joint. The doctor should correct any anatomical leg length discrepancy. If the cause of the pain has been identified as a rheumatological condition, then it might be appropriate to refer the patient to a rheumatology consultant for further investigations and treatment. There are newer treatments being tried, including injection of platelet-rich plasma, PRP, and/or bone marrow concentrate. With PRP, platelets are collected from your blood and concentrated into a sample. The sample is then injected into the affected area. This releases growth factors that increase the number of reparative cells produced by your body, enhancing and speeding up the healing process. If the patient is still hurting after conservation therapies, the doctor might suggest steroid shots. Cortisone can be injected directly into the sacroiliac joint to reduce inflammation and pain. The patient can get up to 3 injections in a 6-month period or 4 injections in 1 year. Any persistent pain can be treated with radiofrequency ablation, which is a procedure that uses an electrical current to destroy the nerve fibers carrying pain signals in the joint, therefore reducing pain. When non-surgical treatments have not resolved the symptoms, surgery is considered. Sacroiliac joint fusion is the surgery used to address sacroiliac joint pain. It aims to stop all movement at the sacroiliac joint by joining the ilium and sacrum together using screws and sometimes a bone graft.